There were big developments concerning health care this last legislative session. We'll tell you how some of them could impact you next. You're watching Fox 45 Morning News Weekends. Well, the 2018 Maryland legislative session is now behind us, but some big events happen in terms of health care. We have DeMattos, president of the Health Facilities Association of Maryland, joining us this morning with some of the biggest health care takeaways that happened during the last session. And thank you so much for being with us
Shelley,
this morning.
thanks for having me again this morning.
You know, so much happens, it can be difficult to keep track of everything.
It was actually a pretty active session, and I think the last time we spoke, I predicted it was going to be fairly bipartisan, and it was. You know, again, the legislators in Annapolis, both on the Republican side and the Democratic side, proved that they could work together in a bipartisan fashion for the benefit of Marylanders, and they did that.
It's good. It's what we like to see. It's why they're in there, right?
Yeah, that's why they're in there, and they actually do a pretty good job at it most of the time. So I think that, you know, obviously the big accomplishment is the General Assembly passing the one thing that they're mandated to do, and that's to pass a budget.
Yeah.
So they passed a $44 billion budget, and in that budget it included an incremental increase for quality care for Marylanders in need in skilled nursing and rehab centers, 3%. So the total budget is about $44.5 billion.
Okay.
A 3% increase in the rate for skilled nursing and rehab centers caring for Marylanders most in need is about $18 million in state funds. So compare the two, but it's really, really, really important. The other thing that the General Assembly did that was really of national importance is they passed legislation to protect about 150,000 Marylanders who are buying their health insurance through the exchange.
Okay.
All that's been happening in Congress relative to national health care and Obamacare and the exchange had the potential to really disrupt the cost of health insurance here in Maryland. And the leaders of the General Assembly came together with the governor, both of them meeting in the middle, and created about a $400 million fund to prop up the exchanges and support the cost of health care for those 150,000 Marylanders supported by the exchanges. Again, relative to the 3% increase to skilled nursing and rehab centers, that's so important, not just in terms of being able to continue to provide quality care for Marylanders in need, both transitional and rehab and long-term care in skilled nursing and rehab centers, but also relative to protecting and making sure that our Maryland hospital contract, our all-payer contract waiver system, is successful going forward.
How soon are we going to see the effects of this? Is that immediate?
So yeah, so we'll see the effects of the budget now, between now and the start of the fiscal year in July. Propping up the exchange, again, extraordinarily important. Had the General Assembly and the governor not been proactive to create that reinsurance fund for those 150,000 Marylanders, they would have seen probably 50% increases in their insurance rates in the fall. So again, it was really important for those leaders to come together and do that, as it was again important for them to pass a 3% rate increase for skilled nursing and rehab centers, so that again we can continue to provide that quality care and partner with hospitals to reduce the total cost of care in Maryland.
Well, Joe DeMattos, thank you so much for joining us this morning. I always appreciate your takeaways and your predictions. So thank you.
Thank you. It worked out this time.
Yeah, it did.